For a lot of us, when you go to work in the morning, you get a pretty good idea of what the day is going to be like. Sometimes it's mundane, but there aren't always a lot of surprises. That is not necessarily the case for Dr. LouAnn Woodward. She is Dean of the School of Medicine at the University of Mississippi Medical Center and Vice Chancellor of Health Affairs. Is there something invigorating about going to the office every morning having no idea what's going to end up on your plate?
I'm not sure invigorating is the word I would use, but it's never boring. It's never dull. It's always exciting. There's always a challenge. And the wonderful thing about the work that we do at the medical center is there's lots of good work to be done. Yes, there are challenges that come our way, but it's always an exciting place to be. Maybe invigorating is the word I'll start to use. I like it.
There we go. Good morning to you, by the way. Thanks for coming in.
Good morning.
Always good to visit. Dr. LouAnn Woodward, Dean of the School of Medicine, and she's over health affairs as well at UMMC. There's so many different places we could start. My wife and I were in Jackson for 10 months back in 2009, I think it was, 2008, 2009. She was in pharmacy school. And the changes at UMMC, if nothing else, from just the way it looks from the outside, from then until where you are now, it's like it is an entirely different place.
It really is. It has changed so much over the last 10, 20 years. It's been so thrilling to be a part of that growth and part of that change. It doesn't matter what you look at, whether it's the education piece, the research piece, the clinical piece, the physical plant of the campus, actually the way that we upkeep the grounds. It just doesn't matter what part that you look at. There's been a lot of change, a lot of positive change. It's been an exciting and fun, and I'm going to say now invigorating journey.
I like it.
To be a part of that. It's really spectacular.
I know I've asked you about this in the past, but just remind, how often do you find yourself still in the classroom or on the floor in the hospital? Does it ever happen anymore?
So that depends. I do participate in some of the education activities, not nearly to the degree that I used to. Now I'm sort of a guest, speaker or guest, right, what have you. There are different opportunities where we have regular meetings with students from different schools and student leadership. So that happens on a routine basis. And then as far as taking care of patients, I am not taking care of patients myself, but many days a week, I hate to say every single day, but most days a week, I am out and about and talking to people who are taking care of patients, walking the floors. Yesterday afternoon I picked up 6 pieces of trash out in front of the adult hospital and then went into the lobby and actually talked to several people there. So I feel it is critically important for myself and all of the leadership team to be out and about in formal ways and informal ways. We do specifically some leadership rounds at different times of the day and night. Next week, I hope this isn't a spoiler alert, but next week I'm going to be up there one evening, late in the evening, to help with a little, passing out some goodies and stuff for some of our night shift employees. So they're all
asleep right now. You're good.
or
they're on their way to bed.
So, there are lots of ways, like I said, that formally we have activities so that we're out in the classrooms and in the halls of the hospital. But then there's a lot of informal activity around that as well. It's very important.
There's such a uniqueness to a teaching hospital, a university setting hospital, and it's almost like intuitively there's some people who are like, I don't know if I want to go to a place where there are a bunch of college students or medical students who are learning on the fly. I don't want to be like a crash test dummy here. And yet routinely you see university hospitals, teaching hospitals providing some of the best care that you can get anywhere. How does that work? Why does it work that way?
So, we're well aware of that sort of thought that's out there. I've even had people say to me, I don't want to be a guinea pig. Well, we don't.
Probably a better word than crash test dummy. We'll hold on to invigorating, but we'll get rid of crash test dummy.
And the fact is, that's not how it is. Nobody wants that. That is absolutely not how it is. there are all sorts of, whether you look at health professional school accreditation standards or you look at other rules and regulations, there are all sorts of reasons why that doesn't happen, and just not the right thing for patient care. The way that it, I think, enhances patient care is, in fact, as an attending, which is what we call the physicians who are leading the teams, kind of the grown-up doctors, no longer in any training, we are attendings. As an attending in that environment, you have to be on your toes because you've got this host of people who are asking you questions all the time. Why are we doing this? Why didn't we think about this? Well, what about this idea? So there is that real sense of, you have to be on your toes all the time because not only are your patients and the patient families asking you questions, but the medical students, the residents, the fellows, the nursing students, the students from all the different schools, they want to learn, they want to know. You have to be able to explain things in a different way. So you can't get, you have to keep your knowledge and skills fresh and up to par. And also at an academic medical center, we've got the research component where people are looking at cutting edge research and cutting edge treatments and things like that. So from that standpoint, I think it is the opportunity really to provide a different level of care for the patients that is that higher level of more complex care, as opposed to sort of that old possible thought process of, well, I don't want to go there because I don't want to be a guinea pig. Yeah. And many times, it's so fascinating because many times the students, I'm just going to make these numbers up to give you an example. An attending on a service might have 25 patients. Well, there are 3 or 4 students on that service, so the students each only have, 5, 6, 7, 8 patients. They actually get to spend a lot of time with those patients, talking to them. It's a lot of one-on-one time, and many times the patients really get attached to their students and understand that they are a true part of the care team. Yeah, it's a wonderful environment.
I don't remember the exact numbers, but a few years ago, I know there was a lot of financial concern as it pertained to UMMC. The outside appearance is that the hospital, medical school, everything related to UMMC is in a better place financially now than it was a decade ago. Is that accurate?
So, yes, it's accurate. And I'll say this, actually next week, March 1st, I guess that's this weekend, will be my completion of my 10th year in the job. So I have been thinking a fair amount about the last 10 years. And if you'll recall, in the 2016, 2017, even into 2018 timeframe, we had a number of unexpected and unplanned cuts to our budget. Through one avenue, it was through state appropriations, and through another avenue, it was around some of the supplemental funds that come in from the federal government, from CMS, to help offset the cost of uncompensated care. And, tiny tweaks in their formulas can have a big impact, for the entities at the front line. So that was a very challenging time. We had to deal with that. Then coming out of that, a year or two later, 2020, we all know what happened, the tornado that hit the world and the fallout from that. So over these last 10 years, because of a variety of different things, we've really had to look at our finances differently. And we have, taken the opportunity to do a lot of different things. We have been more aggressive in achieving grant funding for our research programs. We have learned to be more efficient, and all of those sorts of activities that are important to a strong financial position.
Those things all working together to have UMMC in as good a place as it has ever been right now under the leadership of Dr. LouAnn Woodward. We're going to continue the conversation. Not only does she have the role of being dean of the medical school and overseeing the hospital, she also is the primary liaison to the state legislature. We'll talk with that. We'll talk about what some of the things that are happening in Washington, D.C. mean for UMMC or could potentially mean for UMMC going forward. That and more when we continue with Dr. LouAnn Woodward from UMMC on Mornings with Richard Cross. 8:30 this morning, musician Paul Thorne will join us. Look forward to the conversation with him coming up a little bit later. Right now, though, we are joined by Dr. LouAnn Woodward, Dean of the School of Medicine at UMMC. You mentioned a decade, or coming up on a decade. I think you said on March 1st. I'm sure at times that feels like it has gone by in the blink of an eye, and at times it feels like it has been multiple lifetimes. There's been growth. There's been expansion. We talked about kind of the physical piece of it on the main UMMC campus, but also an expansion into other parts of the Jackson metro area, including the new Colony Park South location.
That's right. That's right. So I want to say a couple of things about that, but before I forget, I also just want to say congratulations to you for being, named permanently in this seat. We will all miss Paul and the Paul-isms, that we
there were quite a few of them
that we came to know and love. But congratulations to you, and we really look forward to working with you and having you in this seat in this time slot. So that's
I
fun.
appreciate that very much.
But yes, so we are, everything. All the programs at the medical center are growing. Like I said, whether it's education, we've got a school of nursing building going up. We've got a school of dentistry building we're breaking ground on next week. We've got research programs that are growing, and the clinical programs are growing. And our campus is fairly landlocked. We're kind of landlocked where we are. We are making some efforts to either expand east or west and talking to some of our state legislatures about the DPS property, et cetera. But we're landlocked, and in the area where we are, it is, I'm just going to say, best if we can control things like water supply and security. So that is an important piece for us. And we are trying to have our campus be not quite as congested. I don't know, hopefully you've been there since 2009, like you mentioned, but I don't know. But people are lost. It's congested. It's hard to navigate around. And we are trying to move some of those things off campus that are high volume, outpatient kind of activities so that we can really focus our own campus, especially main hospital, activities around the things where people really need to be in the hospital, the critical care patients, the patients that are going to have surgeries, and that they're going to not only be admitted, they're probably going to be in the ICU for a few days, and those sorts of things. So we are expanding into that Colony Park area, and we are really excited about it. I think it will be wonderful, fresh space. It will be easy access for patients. We are excited about having students and residents and other learners in those kind of spaces that are more like what they will experience when they go out in their own practice.
Is that also strategic from a financial standpoint?
It is. It is. We think that being able to get off of our campus and to get out into communities, we've got some clinics out at Grants Ferry, out in that direction. Yeah. We've clearly got some clinics in Grenada. We've actually got clinic footprint, whether it's pediatrics or adult. Our clinic footprint extends the whole entire state, honestly. And it is good for us to be able to get out there closer to where patients are.
I have a question that's probably off your radar, and you'll just have to indulge me here if you don't mind. But I ask this because I have a 9th grade daughter, and she is in that stage where people are starting to say, hey, what do you want to be when you grow up? Or what are you going to do when you go to college? When it feels like when kids are 5, everybody either wants to be a doctor or a firefighter or maybe a nurse, or they want to be a professional athlete.
Yes,
like those are kind of the standard answers. But when you talk to young people that are in the early stages of high school and you hear somebody say, hey, I want to be a doctor, what do you say to them?
So first of all, I say, yay, this is great. There are some people...
And maybe I should say not just a doctor, but maybe a health professional. Doctor, nurse, occupational therapist, et cetera.
Because kids, especially young kids and kids in middle school age and even early high school, many times don't even know what the choices are. They just see healthcare and they think either doctor or nurse. They don't even think about all the other different choices because there are so many things that great careers in healthcare. There are people in my generation and older who would certainly say to a young person, it's not like it used to be, don't do it. It's overregulated, blah, blah, blah.
Right.
And there are challenges, but nothing is like it used to be. I mean, no profession, no career is like it used to be. And in healthcare, you have the opportunity to work with people that need your services. If you are inspired and excited by the opportunity to work with people in a time of need and to help them and to be with them along their healthcare journey, it's a wonderful career. It is so rewarding in so many ways. There's such a need. So, I would love to talk to kids that think they're interested in healthcare because it is yes, there are challenges, but there are challenges with everything. Sure. And it is just unbelievably rewarding and a very special thing, I think, to be able to do with your career and with your life.
If you're trying to convince them, I wouldn't lead with an extra 8 to 12 years of school. I don't know that's the number one selling point for somebody who's thinking high school is never going to end.
One of the things because sometimes kids, this would typically be the older high school or younger college age student. Sometimes they look at that timeline and it is daunting and they think, I'm not sure I want to do that. But a way to think about it is the time is going to pass. As long as you are alive, the time is going to pass. Something is going to be happening with your life. Don't think about the next 2 to 3 years. Think about where do I want to be in 10 years. That just to think about it in that way and you realize I can have accomplished this goal or I'll be doing something else. I mean, so
sure.
I would encourage people to think about that.
Visiting with Dr. LouAnn Woodward. She's Dean of the School of Medicine at UMMC and also Vice Chancellor for Health Affairs in the University of Mississippi system. Let's get back to the government piece of it because there's the doctor piece of it, there's the hospital piece of it, there's the administration piece of it, and then there's the relationship with the legislature. You have to be active in that role, but it's not just the state legislature. What about at the federal level? And you got executive orders coming down right now so fast that it's almost hard to keep up with what the president's doing on a daily basis.
That's right.
Is there anything that has happened so far in terms of an executive order that is already or is about to affect UMMC?
So a couple of things, and I want to back up just a second to the state, if that's all right.
Sure.
So, we are a state institution, and so that makes us different than other hospitals and health systems. We actually have a legislative mandate to provide care to the underserved. Mm-hmm. No other hospital or health system has that. We take that very seriously. We try to work very closely with our state leaders and state legislators because so much of what we do is in partnership with them, and it's really important. And so that is a relationship that feels very intense during these months of the session, but it doesn't end when the session is over. We are in communication and collaboration with them all throughout the year, and it's a critically important partnership. Now, at the federal level, as you said, we've got new administration, we've got a new president. President Trump is putting out executive orders. And in some cases, there's a feeling of a little bit of whiplash. An executive order comes out, then there's a restraining order, then there's this. So the main thing that I'm advising our team is, okay, first of all, let's just be calm. Number one, be calm. And we've really got to get some clarity on some of the definitions and the intent. So just to give you a couple of examples, there's both executive order and there are state bills that are being passed around DEI programs.
Right.
So the question that I have is, what is the definition? What do you mean? And people, from the second these executive orders or bills are dropped or whatever, the next question people ask is, well, what does that mean to you? What does that mean to the medical center? What are you going to have to do? And the truth is, it depends on what the definitions are. So in Mississippi, you know where we are on all the list around health outcomes. We've got a lot of health disparities. Most of the state is medically underserved, would qualify as medically underserved. Maybe a couple of the big towns don't, but most of the state does. We have research programs, clinical programs that are directed at healthcare disparities and medically underserved areas. The rural physicians and dental scholarship program is designed to get physicians and dentists and medical students to go practice in rural parts of the state. Those are medically underserved areas. There are health disparities there. Is this going to be something that's not allowed? I don't think that's the intent, but we need to know what is the intent.
Have you got time to hang with me for one more segment?
I do, because there's another example I want to give you.
All right, and I've got more questions as well, and the time certainly goes quickly. I will read you one message from the ceasefire text line as we go to the break.
Okay.
Proud of our Carroll County girl. You go, LouAnn. That is Kirk from Carroll County.
Thank you for that.
Quick time out. This is Mornings with Richard Cross on SuperTalk Mississippi. You want to join the conversation, you can do so on the ceasefire text line, 601-879-4395. We're back with you and more with Dr. LouAnn Woodward right after this. Back on MRC, thanks for being with us this morning on Super Talk Mississippi. Dr. LouAnn Woodward is my guest, kind with her time this morning. We were talking before the break about executive orders and other policy coming down from the federal level, and you said there was one more example that you had that you wanted to get to.
Yes. So again, sort of the that overarching message that we're trying internally to hold steady is just to be calm, because we don't know where all the dust is going to settle. The only grant that we've gotten a cease or a stop order on is a grant that one of our pediatricians holds with collaborators from UAB, looking at parasites in soil. So, who would have thought that? We got a stop order on that grant, and then 2 or 3 days later we got never mind, go ahead and continue. So there's just a lot of uncertainty related to what's going to shake out, what definitions are going to be applied, and so we're just awaiting, further information. We've talked to our congressional delegation in Washington, and even up there, there's not a lot of clarity or a real knowledge around, what does this mean exactly. So we are waiting and like everybody else, watching everything and trying to be as current as we can and stay on top of it.
I think regardless of where you fall politically, you recognize that if you're trying to clean up a mess, sometimes it gets messier before it gets clean.
100%. In my own just personal experience, if you're going to clean that closet out, it's going to look worse before it gets better. That is just the way it is.
Example.
That's right. That is just the way it is. And I feel, and I think, I certainly can't speak for anybody else, but I think that a majority of people feel that we need to do a better job with the federal government, with the balance, with the budget. That's the word I was looking for, with the budget, and not have such a deficit. And we need to look at spending and be sure that we're spending it on things that are valuable and important. So certainly myself, I'm all in favor of looking at these things where there's unnecessary or whatever kind of spending that's just crazy to get it right. But it does create some turbulence and a little bit of chaos.
Well, and one of the massive expenses at the federal level, and frankly at the state level as well, is Medicare, Medicaid. Mm-hmm. And you talk about uncertainty a second ago. It feels like that's kind of at the top of the list of uncertainty, and even some conversation about block grant funding going forward, and not knowing exactly what that would mean. What percentage of patients that come through UMMC are Medicare, Medicaid?
So if you look at Medicare
Roughly.
and Medicaid together, it's going to be, and again, it's going to vary day to day, week to week, month to month, but we track it monthly, and look at it year over year, of course. So it's around 70% Medicare, Medicaid, about 70% when you put those two together. It's around 40% Medicaid, 30% Medicare, about and the easy way to remember it is, again, you look at it year over year and it fluctuates, but it's typically falls into these buckets: 40, 30, 20, 10, 20% commercial and 10% patients with no insurance. Oh, wow. So that's the distribution of our payer mix over time.
Yeah. I don't know if you have a strong opinion on this one way or the other. One of the issues that is before the legislature right now, there's been a bill on both the Senate and the House side, is PBM related, pharmacy benefit managers. And School of Pharmacy is its own entity, but it falls under UMMC, right? Is that the way to describe that?
No, the School of Pharmacy actually falls under Ole Miss.
Okay.
So Ole Miss,
but Ole Miss pharmacy students come to Jackson for a period as well.
That's right. So School of Pharmacy students, they're admitted through Ole Miss. They graduated Ole Miss. But for some of their clinical training, they come to the medical center and are on our campus for a couple of years. Likewise, the School of Nursing is our school at the medical center, but we have, over the last few years, established sites for that school at Ole Miss, both the accelerated program and the traditional program. So for those two programs, nursing and pharmacy, there's some back and forth of students between Oxford and Ole Miss. But the pharmacy school is officially an Ole Miss school. The nursing school is officially the medical center school.
Gotcha. That PBM legislation, pharmacy benefit managers, I mean, it's part of the spider web of the healthcare system. Mm-hmm. Any thoughts on where that, or you want to just set that one out? Well,
I will say that pharmacy benefit managing programs are challenging for us. So I'll say that. And your description of the healthcare delivery system being a web is perfect, because it's a web, and on many days, the fact is it just doesn't make sense. Yeah. But it's a challenge.
One of my passions, and I'm assuming one of yours as well, is organizations that do good for children. And I feel like I'm remiss not to ask you about Children's of Mississippi and the growth that's happening there over the last few years. I think every time we talk, I'm going to ask you something about Children's of Mississippi.
Good.
It is an unbelievably beautiful facility. There has been a ton of charitable giving to allow some of those things to happen. Do you smile every time you drive by and you see that facility, and then when you're walking around inside it?
I do. So and it's called the Joe and Kathy Sanderson Towers, and right. It's called that for a reason, because Joe and Kathy Sanderson were so instrumental in both their own personal giving as well as reaching out to others and helping us achieve that. We had a $100 million capital campaign to go toward that tower. Was a $180 million total tower, but we were able to raise $100 million of it through that capital campaign. And we're in some early phases now around a cancer capital campaign. And you may have seen some of the communications recently. John and Sandy Black gave a $25 million gift toward that campaign. And I cringe when I hear people use the word transformational, because it's just overused. But there's really not another word that is as appropriate as that for what this kind of gift means. It is truly transformational and just a huge boost to the work that we're now doing and planning for the next few years in cancer.
And they've been incredibly generous to the University of Mississippi writ large. I mean, athletics and Oxford academic side on the Oxford campus, and now at UMMC.
People like that, Joe and Kathy, John and Sandy Black, they are leaders. They're the kind of people who can see a vision and work toward that vision and help make a vision become reality. I walk through, back to the Sanderson Tower. I walk through Sanderson Tower and I look at it, and I've told Joe, and I've sent him text messages. I walk through here and I think about you, because it's just spectacular.
I'm going to do something they told us not to do in journalism school, and let's ask a two-part question. You said coming up on a decade, March 1st. Mm-hmm. One, can you do this another decade? And if the answer is yes, what do things look like at UMMC 10 years from now?
So I'll say this: I'm not going to do it another 10 years.
Okay.
However, I also don't have a time frame in mind, but I just know that it's not going to be 10 years. I don't know what it's going to be, but regardless of that, whether I'm here 10 years from now or somebody else is here 10 years from now, or 5 years from now, so we have continued planned growth. Our overall mission is to improve the health of Mississippians. And oh my stars, we've still got a lot of hard work to do in that space, and we're excited about it. We are really excited about it. You know, back to, I want to say something about the finances, because I don't want to leave anybody who's listening thinking that we're over here just rolling in money, because nothing could be further than the truth. You know, in healthcare and in health hospitals and healthcare hospital systems, at least I can say the ones in Mississippi and the ones who serve a mission like we do, where part of your mission is being a safety net hospital. If you have a 1 or a 2 or 3% margin at the end of the year, that's a positive margin.
Yeah.
You feel like you can do big things. Most businesses would shut the doors if that was their reality at the end of a year. So we live and die on a razor-thin margin. But what we are really committed to doing, which is hard, and it takes a lot of discipline, and it takes a lot of making some people upset with you, is maintaining a focus and focusing on those key strategic priorities. We cannot be all things for all people. We can't do everything. But just like to your point earlier about the work that we've done in children's, that wasn't by accident. It's because for 5-6 years we said we're investing in children's and we're doing this. So it requires a lot of strategic discipline to be able to grow the programs that we're growing.
Thanks so much for your time this morning. Really enjoyed the conversation.
It's been great. Thank you.
Look forward to visiting with you again soon. Dr. LouAnn Woodward, Dean of the School of Medicine at the University of Mississippi Medical Center, and she's over Health Affairs as well, Vice Chancellor through the University of Mississippi. So much happening, and I appreciate a little bit of extra time to kind of unpack some of what's happening at UMMC. We are going to wrap up the 7 o'clock hour with you, and when we come back, we are going to give you a chance to win. You like 80s music? Stay tuned. We're back after this. Mornings with Richard Cross on SuperTalk Mississippi.